use the word pioneer because it has age connotations, but I am also thrilled to be sitting between two of the shakers and movers in environmental public health. So this is a real opportunity to express my appreciation. I had the responsibility for the fourth session. One of the things about this slide is, in years I've been associated with IOM, we do not know how to have a short title for a workshop. But I do have, if we can go to the next slide, I think I shifted sometime during the evening last night from synthesis to observations and opinions. But let me hit upon a couple of things I thought struck me. One was the incredible innovation that was presented, but even more so, the resourcefulness that we've seen at the state, at the federal level, in terms of, with limited resources, being able to go and mine very creatively a variety of databases and begin to assemble those that will help guide the prioritization process. And I was very impressed with that. I think there are challenges as to how you get these different databases to be interoperable and talk to one another and so forth. But I was just really amazed about the nature of efforts that folks have put out, again, in a limited resource situation. The other thing that struck me is it's not a one-size-fits-all in these discussions. From our own speakers here, we know that they were representing sort of different levels from the national down to the state, and our discussions that Gina did on the state also pointed out the communities as very important stakeholders. It depends on what the focus is. You know, the classic, some of these are looking at classic risk assessments. We look at the risk to the individuals. Others are looking at populations, susceptible, vulnerable populations, and others are looking at communities. And then we're held accountable by different sets of stakeholders in what we're trying to do. And I think when we begin to look at the system for prioritization, that probably isn't going to happen, where it's going to be widely applicable across these different venues and populations. And I think that the range of tools that we're going to have to react to the where we come out in the prioritization will range on some occasions to using regulation. I do believe that in the current climate and over the next many years, the regulatory hammer is not going to be pulled out as often as it has in the past. I think it simply won't fly. But also moving down to where you provide consumer advice and expect the consumer to take some responsibility for what they come into contact with and what they digest and so forth. So I think there's a whole range of responsible parties in terms of really trying to build off what we learned through the prioritization process. It struck me also that the level of caution or precaution tends to differ as well, and there's a range. We saw, in some instances, moving ahead boldly with what you have in hand. In terms of certainly what we saw at the state levels, and I think true also in Canada, to the other side of that spectrum where there's a need for our comfort level that will be tied to further reaffirmation of the decision that you're going to make with prioritization and the trade-offs in doing that. And I think EPA historically has fallen into that bin of being more conservative before moving forward with sort of these prioritization schemes. Having said that, when I went back, and I did have the privilege of having hard copies of the briefings, they all, to some extent, more or less use a matrix where they've got some characteristics that would define hazard on one of the axes, and then doing as best as they can to define exposure on the other axis as well. And there are some interesting linchpins that came out in the discussion, or some common aspects that came out. One of these is biomonitoring that was repeated. You know, we had a chance, Megan Lackshaw sent I guess an email and joined us today, but as I wanted to reflect again, I think the opportunity for biomonitoring, acquisition biomonitoring data is becoming greatly enhanced. And one of the things, as I mentioned, I thought a resource that we've certainly, as EPA, have not tapped sufficiently, has been the state laboratory capabilities, where they have these very substantial databases, not solely on biomonitoring, but on environment. And they have it down to geographic units that probably make it much more valuable than what we're solely able to extract out of NHANES. EPA has regional laboratories that also provide primarily information on environmental concentrations, but I think those are resources we haven't tapped to bring more exposure information to the table. One of the other complications that Bernie mentioned, and everybody else is, across the speakers, was CBI. and the ways to reach negotiations on that, that we can be able to draft out additional information without compromising the manufacturer, the producer of the product. Although everybody used a matrix, it was interesting that the data sources and the indicators for hazard and exposure did vary. And there were some, again, some initial data sources, and then also, in some cases, secondary or other considerations. These included whether it was carcinogenic, mutagenic, or reproductive toxicant. Across all the speakers, a modifying factor was whether it was persistent or bioaccumulated. Emphasis across those on vulnerable populations, especially children. Although, I would like to put a pitch in for those of you that are baby boomers, that we have to face the reality of we have increasing survival of older individuals now. Many of us hopefully will be healthy as we reach that stage, but many are bringing in additional diseases or other complications. And this is the baby boomers, the largest cohort ever born in this country. We're not talking about hundreds of thousands, we're talking about millions. And I think there's a vulnerability issue there that we haven't explored that I think you can make some powerful arguments for equal to that of the vulnerability of children. And the other thing that we can't escape from my sense of these schemes is there's still a fair amount of expert judgment that's being used. And I don't think that's bad. I think that's fine in doing that. But some consistency in how we approach the role of expert judgment, I think, is going to be important. Let me move on so as not to abuse my time. I think these move more into the opinion side of these activities. Most of the schemes didn't really talk about whether they've had other snapshots of the information that would look at how valid the prioritization classification schemes that they've used. One that Richard Judson did mention that's of keen interest within EPA is beginning to understand how using adverse pathways may help you get some idea of how to shape your high throughput screening, and then the issues of what do you now compare that data with. And within his center, they've been able to go back and look at a lot of the data available under, for pesticides, for example. We've got in vivo data and begin to sort of crosswalk these as to the predictive validity. I do think that this is a challenge. I think one of the questions is when you're looking at the databases and data scheme migration and integration, is validation actually even needed to be carried out? A term that was used in this session was dealt with right sizing. We've sort of got a term that we call fit for purpose, which is the same thing. And it says basically the content and intensity of the analysis you need to do is tied to the content and intensity of the decision that you have to make. And both the Silver Book as well as the Green Book on sustainability hit on this exact same point. We haven't really had that dialogue, and I think that's one that will be beneficial. The other thing that struck me is whether it would be useful to have a comparison. We heard a variety of approaches to how data sets were being assembled, and I'm wondering if it would be useful to begin to look at taking maybe a small set of test chemicals, running them through these schemes, and see if you end up with sort of the same place that you started. It also, I think, creates opportunities for sharing. It creates opportunities to say where are the data gaps and how might we begin to try and address these in a very positive manner. And then the challenge I think we have, even with good validation, is going to be the issue of having, again, gets back to this cautionary principle, I think, the readily degree to which these will be accepted and adopted and applied by whether you call these clients. Our stakeholders, I think, remains a little bit unsure. And I think that the challenge for us is to begin to sort of change the cultural mind within our organizations that will make them more, make the acceptability of these more readily apparent and allow us to move the science beyond, I think, the rate at which it's moving now. So I think acceptance by and changing the culture of how we approach hazard and exposure is going to be equally important to successfully applying these prioritization schemes. And I'll stop there.
Thank you, Hal. And finally, Lynn Golden on session 5.